looking at the global vector control response strategy and how that's playing out, focusing at the end towards dengue, en route through various vector control activities, apps, as well as the actual mobilization of communities. And then the second section, very detailed, very intense technology in terms of the proteomics and genomic signatures and interactions between the arboviruses and the Aedes aegypti, and even some talk there by Tom Schmidt, from Dr. Tom Schmidt of Melbourne, saying that the Aedes aegypti is actually now a model organism. So fascinating approach there, and fascinating session. I'm absolutely delighted to open this particular session for many, many reasons. And this particular session, the ASEAN Secretariat helped us to build. So massive kudos to Fernando, Michael Glenn, and Randy at the team there in Indonesia that helped us to put this session together. We are championing a global advocacy campaign asking the WHO to ratify a World Dengue Day. Now, the basis of this has been the great, amazing leadership position that the ASEAN member states have taken by putting together the Asian Dengue Day, which is 15th of July every year. We wanted to kind of really build on that and transform that into a global World Dengue Day. And for that, there's a live petition. We've got 25,000 signatures from across the world already and rising. It's in our news tab. And so after this, please feel free to touch that. And you look at our World Dengue Day output, you can see that from our press corps interviews and everything. That's all there for you to digest during the course of the day and beyond. And I just wanted to say that this particular session is quite poignant for us. We're dedicating it to Dr. Sally, in the memory of Dr. Sally Gatchalian, who sadly passed away in March this year. Wonderful person. I had the honor and pleasure of meeting and working with over the last few years in Paris, Indonesia, for dengue, our dengue efforts. She was the president of the Pediatric Infectious Disease Society at the Philippines. It will be very, very missed. A great pioneer in public health in that region. That brings me to the panel. We are delighted to welcome to this Dr. Siti Nadia Tarmizi from the Director of the Vector-Borne and Zoonotic Diseases Prevention and Control Department in the Ministry of Health Indonesia, Dr. Norelyn Evangelista from the National Dengue Program, Prevention and Control Program, Ministry of Health Philippines, and then also Dr. Rose Nani Mudin, who's the head of the Vector-Borne Disease Sector, Ministry of Health, Malaysia, who's just logging on as we speak. I don't know if I should be saying Selamat Pagi, Selamat Siang, or Selamat Sore to you all, but I'll definitely say Terima kasih to everybody for making time for this. And on that note, you through to Dr. Siti Nadia Tarmizi. A round of applause for the first speaker. Over to you, Nadia. Thank you.
Okay. Thank you, Kamran, for the time. Of course, first of all, I would like to thank and congratulate to ISNTD for having this event. And thanks for the opportunity to share Indonesia's experience in maintaining dengue prevention and control in Indonesia. I will start with my slide, I think. I hope it's working. Okay, it's working. Okay. Okay. I will start by giving you like a brief overview regarding our country. As you might know, Indonesia consists of more than 17,000 islands, more than 260 million population with many various cultures. Transportation between region and area is carried out by flight, ship, longboat, even by car or bus. Even some area we still use a back of horse or on your own foot. Lying along equator line with 1.9 million kilometer square, consists with 34 provincial, 514 district and municipalities. We have identified 150 species of mosquito as the factor with various characteristics of breeding places, such as a brackish water area, paddy field, swamp, forested area, small watershed, and residential area, such as like in the yard. And Indonesia have been implementing national health insurance since 2000, and the management of dengue cases already part of this scheme. And in this slide, I would like to give an overview about our dengue situation in Indonesia. As you can see, our cases start in 1968 with 58 cases, and gradually it become more and more. So in 2020, right now we have like found 74 260 cases with the death case 472. If we compare 2020, if you can see here the graph, the case is lower compared to the last year. Here more clearly about the number of cases if we compare 2019, 2020. In July 2019, we have like 105,000 cases. Now we only have 74,000 cases. With the death case, last year is 751 cases. Now is 472 cases. The problem is in 468 districts, which they are reporting dengue cases. This district also affected by COVID-19. So we have like 514 districts out of 540 districts, which is 468 districts have dengue cases and COVID cases. You can see in Sumatra, in Java Island and small island eastern of Nusa Tenggara, both number of cases and mortality quite high. But in southern part of Sulawesi, the number of cases medium. It's showing by the yellow color, but the mortality is high, like this. You can see this one, this part is yellow, and this one is high. This is a situation that challenges for our program in terms of factor control and surveillance. As you know, we have medium cases, but high mortality cases. So high mortality cases. So I think this one a problem that might be a challenge by when someone already or the patient already comes to the health facility, but maybe they already come in very late stage, so we are not able to save their lives. On the in my next slide here, I will show you what the National Dengue Prevention Control and Program. There are three main pillars, which are surveillance, case management, and factor control. In terms of surveillance, we do the case surveillance, factor surveillance, and risk factor of surveillance. As we know that Aedes is the factor for dengue. Case surveillance carry out case transmission of the case. It is based on the report from the health center to the hospital. So far, we have like 826 public hospital, 1,600 private hospital, and we have like around 200 army and police hospital. Besides that, we have like 9,900 primary health care, which half of them they have like a laboratory technician. In factor surveillance, after we are receiving report a case from the Puskesmas or from the district and city health services will carry out the vector surveillance activity. Just to inform you, we have like 4,500 larva observer that help health facility staff to carry out the vector surveillance. For the risk factor, surveillance carried out by preventive and promotive action for dengue is carried out by Puskesmas with the community participation. For the case management, of course, we are using WHO classification and the Puskesmas or the primary healthcare carry out early detection for dengue, while the hospital is for reference for the next cases. And for the vector control, we do some activities starting from prevent contact between humans and vectors, and then reduce longevity and reduce density of the vector itself. Yeah. So in terms of the pandemic COVID-19, of course, it has been a challenge for us too. We know the epidemiologic investigation was not carried out very well during the COVID-19 because of social and physical distancing that we have. And of course, since we are suddenly leaving many buildings, school, church, mosquito, mass, and hotels, of course, one of the challenge is we controlling breeding places in abandoned areas or all the building. So we need to have more attention in those building when they plan to reopen. Besides the disinfection for COVID-19 prevention, they have to do clearance for mosquito breeding in that area. And then some activities that we are postponing, such as coordination and then training. As much as we can do, we try to put it as a virtual meeting rather than as we are usually do previously. As we know that during COVID-19, program needs to be adjusted, and we need to put extra attention. So for this, we have developed and launched a new protocol of dengue prevention during COVID-19, in where health workers need to wear proper personal protection equipment during activities when they are doing some activities out in outdoor area. And then health workers need to educate and empower community to observe and to control breeding places at home. Because we know in this situation, involving community, household is play a very key role. In my next slide, I want to share about although we are having COVID-19 pandemic, we are able to commemorate ASEAN Dengue Day 2020. I think ASEAN Dengue Day 2020 is a moment for our opportunity to increase the awareness for dengue campaign during COVID-19. We encourage province and district to organize this awareness campaign by virtual or any activities through social media. Our Director General has sent a letter to the province and the district regarding their involvement to increase awareness for dengue campaign. Of course, we are aware that during pandemic COVID-19, all resources goes in tackling the pandemic, but we cannot stop to remind the dengue still around us, and it will be another outbreak if we are not put attention since the beginning. And secondly, we are collaborate with the health professional organization. We are conduct national webinar on dengue. We also conduct national talk show on dengue with collaboration with the National COVID-19 Response Acceleration Task Force, which in our opinion, it's quite successful in attracting the attention of the media and community beside the COVID-19. Because previously, all the news, all the media only talking about the COVID-19, although number of dengue quite high in Indonesia. So I think this is my last slide. To conclude, well, based on what I have been presented, that dengue is still a burden in Indonesia, beside COVID-19 that we are facing. And therefore, to enhance and to sustain factor control and case surveillance in order to prevent disease outbreak is important. Involving household members, increasing community awareness and participation in factor control and early case finding must be highly promoted, although we are focusing on COVID-19. Innovation and research must be developed, including the study on co-infection between dengue and COVID-19, and ensure the implementation of the COVID-19 transmission prevention protocol goes well, so we can conduct activities for dengue prevention. And with regard to the ASEAN Dengue Day, we think that this is a good platform to maintain awareness of dengue and to increase commitment to tackle dengue among all the related stakeholders. To make this opportunity bigger, I think that is worth proposing a World Dengue Day to get bigger and wider support to tackle dengue globally. And thanks for International Society Neglected Tropical Disease for your contribution for advocating globally. And of course, for my colleagues, ASEAN Secretariat, thank you for keeping your support and your commitment for advocating dengue at regionally. I think that's all, Kamran. Thank you very much. Over to you, Kamran.
To go back on. Terima kasih, Dr. Tarmizi, Nadia, that was wonderful. Thank you very, very much. And really, I mean, we're getting a lot of questions coming through on the chat. The level of community engagement that you're able to reach, given Stephen Brahmia of Canada, he's put a question in already saying, what an amazing effort, given the archipelago, given the discrete islands and the gaps. What an amazing effort! And I'll put that to you in the Q&A actually a bit later. There must be something there inherent in the people, that they have a sense of community obligation and a sense of belonging, that they're able to come together and push vector controls. Without the communities being engaged, it's not going to happen. So absolutely wonderful. And we really appreciate the fact that you're standing with us in pushing forward for a World Dengue Day. We felt that the Asian Dengue Day needed that exposure and the leadership position. There's so much to learn from your effort, that you deserve that, in the sense that the other countries where dengue is spreading to can look at what you've done and learn in the true spirit of collaboration. So we'll come to that, and I'd like to applaud you for that, Terima kasih. And I will, because of timing, I'm going to go to the next speaker, if possible, and we'll join you back, Nadia, for the question and answer session shortly. So our next speaker was Dr. Rose Mudin from the Ministry of Health Malaysia. She's just having a little connection issue with the browser that's not that working, and both tech teams on both sides are trying to resolve that. So we'll go straight to the third speaker, who we are very happy to have, because we found out this morning, about half an hour or so, an hour before we were starting at the UK time, we were delighted to hear back from the ASEAN Secretariat, Ferdinand Fernando, Randy, and Michael Glenn, who've been instrumental in putting this panel together with us. We've been liaising for the best part of a year and a half, actually, with them. So we'd like to welcome Dr. Norielyn Evangelista, the program manager at the National Dengue Prevention Control Program at the Ministry of Health Philippines. And, as we were saying before, Norelin, that the Philippines and dengue, it's a very controversial, or not controversial, but it's a very charged, politically and in a community sense, area. So we're so happy to have you on board. We've got an attendance, Professor Lulu Bravo, who emeritus professor on our dengue advisory group as well. I know she met with Senator Duque, the health secretary, when we were trying to put forward country requests to the WHO for their planning meetings for the World Health Assembly. So we'd like to thank Lulu on screen as well for that, before passing over to you. Go Philippines. And I think I'm going to pass over to you. You may have to unmute yourself. You're on mute. I can see that from my screen, and I'll pass over the floor. Round of applause for Dr. Norielyn Evangelista. Thank you.
Thank you, sir. Good day, everyone. First of all, we would like to thank you for giving us an opportunity to present the dengue situation in the Philippines. To begin with, I will give you a brief background of the history of the National Dengue Prevention and Control Program in the Philippines. So the National Dengue Prevention and Control Program was established. This was established in 1993. This was established in 1993, 2 years after the passage of the Local Government Code of 1991. So this is the epidemiologic data of dengue last year, last 2019. So as shown in your screen, from January 1, 2019 to December 31, 2019, we have recorded a cumulative number of 430,280 cases with 1,612 deaths. So last August 6, 2019, we have declared a national dengue outbreak in the Philippines. So during the early months of last year, from January to Feb of 2019, we have prepositioned the logistics and commodities to different regions in preparation for the continuous increase in the number of dengue cases. We have also prepared our health facilities, the hospitals, for the possible surge capacity, and activated the dengue fast lanes, and we have provided manpower to different hospitals across the country. So as shown in your screen is a comparative table of the dengue data statistics comparing 2019 and 2020. So as you can see, for 2019, a cumulative number of 146,706 cases were reported, and for 2020, we have 54,491 cases. So we have observed a 62.87% decrease in the number of cases for this year as compared to last year during the same time period. This is same with the number of deaths. So we could see decrease in the number of deaths comparing 2020 and 2019. So last year, we have reported a number of 688 deaths, comparing to a 71.51 decrease for number of deaths for this year. Same with the case fatality rate. We have observed a 23.4% decrease in the number of case fatality rate comparing 2019 and 2020. Okay, for the following slides that I will be showing you, this is the number of dengue cases for the past 5 years. So from 2015 to 2020. So as shown in your screen, this line graph shows a rapid increase in the number of cases from 2018 to 2019. So we can see a rapid increase in the number of cases and a very steep decline in the number of cases in 2020. Same with the total number of dengue mortalities. So this line graph shows the number of dengue mortalities for the past 5 years from 2015 to 2020. Same with the number of cases. We can see an increase in cases from 2018 to 2019 and a rapid decline in the number of dengue mortalities from 2019 up to the present, so for 2020. Same with the case fatality rate. So from 0.37 last year, the case fatality rate for this year is 0.36. Okay, so these are the key program indicators of the National Dengue Prevention and Control Program. So the key indicators includes the case fatality rate, to maintain the case fatality rate of dengue for less than 1% and reduce annually by 0.1%, reduce morbidity rate by 25%, and reduce dengue mortality rate by 50%. So what are the projects, plans, and activities of the National Dengue Prevention and Control Program for 2020? So currently, the Department of Health is doing a two-way approach in the public health for dengue. On the preventive side of public health, as you can see, we are on the process of evaluation and implementation of integrated vector management, which would include the use of novel biologic agent against dengue mosquitoes. So we are planning to do a pilot implementation of the Walbake project within the Bicol Center for Health Development. And on the curative aspect of public health, we are on the finalization of the National Dengue Prevention and Control Program related administrative issuances. So these are the administrative issuances. In my following slides, I will be discussing the salient points of these administrative issuances. For the first administrative issuance, the guidelines on the establishment of Dengue Center of Excellence, as mentioned earlier, we are setting up Dengue Center of Excellence that would spearhead a higher standard of care of dengue that would also lead in the research and development to achieve our goals. So this issuance shall provide policy direction in the development of standards, in the establishment of Dengue Center of Excellence, and also to define the role of identified tertiary hospitals in providing specialized dengue case management in the country. Next is our administrative order on the guidelines in the implementation of dengue fast lane. So last year, when we declared the national dengue epidemic, we activated the dengue fast lanes. This is also to prevent the congestion of patients in the hospital in the emergency room. So the dengue fast lane would there will be a separate and specialized triage area exclusive for suspected dengue patients and shall likewise function for the sole purpose of efficient, expeditious, and streamlined management for dengue cases. Next is our guideline in the conduct of dengue mortality review. So our mortality review is a detailed assessment of patients that have died of certain disease or diagnosis. So this guideline in the conduct of dengue mortality review will provide recommendations and in identification of the gaps that were being encountered in the health facilities and the hospitals. Next, we also have the intention of expanding the National Dengue Prevention and Control Program to National Aedes-borne Viral Disease Prevention and Control Program. So these orders shall serve as a guide in developing an effective and preventive approach in addressing Aedes mosquito-borne viral diseases in the Philippines, such as dengue, Zika, and chikungunya. And lastly, we are working on our addendum to Administrative Order 2012-0006, the revised dengue clinical case management guidelines. So this AO shall provide updates and revisions as agreed upon by the technical working group on the topic of dengue clinical case management guidelines. So the pictures that are on your screen, so this was taken last Feb 25 to 26, 2020, when we had a collaboration meeting with the World Mosquito Program and Research Institute for Tropical Medicine, or RITM, for the Wolbachia project that is intended to be implemented in the Bicol region. The consultative meeting was also participated by the World Health Organization. Okay, this one, so this is the technical working group or the experts. We convened a technical working group meeting last March 3 to 6, 2020 on the development on dengue clinical practice guidelines, our addendum to our current clinical case management, which is the Administrative Order 2012-0006. So here are the examples of our information, education materials that are being disseminated to the regions. So this was written in Filipino. So right now, we are promoting our enhanced forest strategies. So search and destroy breeding places for the first S, seek early consult, self-protection, and we support fogging in hotspot areas to prevent an impending outbreak. So here are the examples of the rapid advice guidelines or the education and information materials. So when we declared the national dengue epidemic last August 6, 2019, we sustained intensified our advocacies against dengue. We continuously formulate and release issuances policies for the national dengue outbreak. So we have issued the 2019-0315 that is about the national dengue epidemic or outbreak, wherein we provided guidelines or checklist to be followed, not just in the households, but in the communities as well, in the city health office, in the provincial hospitals also. We also conducted monitoring activities in the regions to check for the cascading and the implementation of our issuances. In addition to that, we also issued the implementation of Sabayang for Aklak Habit para Then Get Out for our search and destroy of mosquitoes breeding places around within the facility. Every flag ceremony, not just in the workplaces, but also in the community and households. And then when we observed a decline in the number of cases, we lifted the dengue epidemic declaration last January 30, 2020, but we still continuously issue guidelines to remind the community, the LGUs, the coordinators on strengthening for enhanced forest strategies. And we also the reiteration of implementation of enhanced forest strategies against dengue. So by the virtue of Proclamation number 1204 series of 1998, we celebrate National Dengue Awareness Month every June, and we also celebrate our ASEAN Dengue Day. So for this year, we were planning to celebrate the ASEAN Dengue Day in Zamboanga. However, this was canceled due to COVID-19 mitigation protocols. But we shifted the ASEAN Dengue Day celebration into a web-based seminar platforms, and we have released relevant IEC materials to be distributed to the regions and to the LGUs. So those were the IEC materials that were presented a while ago. We also conducted dengue pressers. So we incorporated the dengue reminders for our COVID presser, and we conducted media forum for celebration of ASEAN Dengue Day. So we know that dengue, with the advent of climate change, rapid urbanization, and increasing global population, has become a disease of multifactorial nature, and the observance of a World Dengue Day would serve to address this complex burden by challenging the government and various public institutions to action and unite a worldwide political will, and in turn to promote awareness, community empowerment, and improved health service delivery. So that's the end of my presentation. Thank you very much for listening.
Thank you. Thank you very, very much, Norelin. Absolutely amazing to hear that. The challenges and actually the little bit of success that you're having with mortality case rates coming down. We were talking about this before we went on. How much a role, again, it's the community. Again, it's the community.
Yes.
It's reaching out and bringing them in. And I think it's especially pertinent in the Philippines setting because of the just the way things unfolded after the Dengvaxia, the entire kind of the inertia that was there. I'm not going to unpack that in this particular session. This is, but it's I'm saying it in a very positive light to you that an amazing thing, an amazing challenge you have to overcome and unite the public and get them moving on this track. I think it's a round of applause, fantastic. And again, thank you very, very much for that last slide in terms of the World Dengue Day. Again, it's really about trying to give the rightful position to the amazing effort that's happening in Asia and South Asia, and really highlight to other countries best practices and actual collaboration. We talk about multi-sectorial, multi-regional. It's almost rhetoric. It has to happen. You guys have done an amazing job, and I think you deserve country by to show the rest of the world this is how we do it, and have that kind of platform. So that's kind of the one of the ethoses behind the World Dengue Day as well. I'm just trying to work out if we're going to have the next speaker ready or not. I'm just bear with me one second. Norelyn, just give me 1 second. I'm just working out because we're supposed to have Dr. Rose Nani Mudin, head of the vector-borne disease sector at the Ministry of Health Malaysia. And I don't think she's on at the moment. There's been a connection issue. Yeah, so just bear with me. So apparently I'm going to share the screen and then Rose will talk. Yeah, so I think we're going to get an audio feed in from Rose, and somehow we're going to share. Rose is ready, apparently. I've heard Rose is ready. So, Assalamu alaikum wa rahmatullah, Rose.
Yeah, hi.
MashaAllah. Thank you. Jazakallah khair. Thank you so much for making time for this. I know there's been a bit of a nightmare trying to get connected, and I'm really, alhamdulillah, we can see you. Big day today as well, Yom Al Arafah, and you've made time for this, and Eid tomorrow. So I can only imagine how many things you've got to do. So we all really appreciate it. I think because of timing, we are just going to, we're going to go straight into your presentation and we'll reassemble for the Q&A. Is that okay with you? Fantastic. And an all-woman panel.
Can you hear me clearly?
Yeah, yes, we can hear you. I can hear you. You may put the volume up a little bit.
Can you hear me?
Yes, perfectly. I'm going to back out and we'll over to you. with the presentation. I think we're ready with the presentation. So over to you.
Okay. Can you hear?
We can hear you. We can hear you.
Uh, I can't see the slide yet. Okay, thank you very much, Mr. Chairman. Good day to all the distinguished panel and also to the conference participants. So thank you for giving Malaysia an opportunity to share on the dengue situation and the management in our country. Next slide, please. These are the contents of my presentation today. Next slide. So, as starting in March, Malaysia reported the COVID cases in our country. So, starting on 18 March, our government has implemented the movement control order in our country. So, you can see in the schedule, in the table, that the movement MCO, the movement control order started on 18 March, and then after that we have a few phases of MCO in the country. Next slide, please. So for the dengue situation in our country, if you see the red line, is the current situations of dengue cases for this year, and the blue line is the previous year's cases, and the green line is the median for 5 years cases. So for this year, we have a reductions of about 30% compared to previous year, and also our debt is also reduced compared to previous year. And the MCO started in our country around 12 weeks after around the week 12 of Epid week in our country. Next slide, please. So following the announcement of movement control order by our government on the 18 March, as early as 24th March, we already come out with the instructions to all our districts and states nationwide on how to go about on the control measures for dengue. So we come out with a few series of instructions order to the field workers, because the COVID situation actually changing from time to time in our country. Next slide. So when we come out with the instructions to our field worker, we give them this table so that as a guide for them to know what they have to do in the field, because during the pandemic there's a lot of changes in the control measure, because we have to protect our health staff from getting the COVID infection, and at the same time they also have to conduct the dengue control measure with the public, and they have to deal with the community and also with the public. So we came out with these guidelines. For example, our dengue surveillance systems were continued as usual, because our dengue surveillance system is a real-time web-based surveillance system. So we have 4 systems, the e-notification, e-dengue, SPWD, and iDengue for the community. So during the MCO, all this surveillance system was carried out as usual. And for our routine case investigations, all the notified cases has been investigated by our staff, but they have to take the standard universal precautions when they are carrying out all the dengue prevention activity. So our National Security Committee came out with the zoning definition. For example, green area is a 0 case of COVID, and yellow with 20 to 40 COVID cases, and the zone is more than 40 cases of COVID. So, however, the dengue control activity will be deferred if it's happened in the COVID case house or at the hotspot of COVID area. So we will defer the dengue control measure. However, usually we will integrate with the COVID team as a minimal preventive measure or control measure for them to carry out together with the COVID control. Next slide, please. So in the case management, all the cases that actually admitted to the hospital will be treated as usual because our medical staff will take the universal standard precautions during the handling of these patients. And all the case investigation is being carried out by our staff as usual. In terms of management of the outbreak, as the passive case detection is carried out as usual, and also during the outbreak situation. So you can see that the activity is tailored to the COVID-19 precautions. Next slide, please. However, for the vector control, for the outbreak or case management or control of outbreak or case, all the activity for vector control will be carried out. But the routine activities, such for example, trying to identify the index, Aedes index, will be deferred at the during the COVID pandemic. And this, for example, the entomological surveillance and will be deferred during the COVID pandemic. However, the supply and the procurement of either diagnostic tools or insecticide will be carried out as usual. So during the COVID pandemic, we need to modify our control activity. For example, the fogging of the patient's house or area. We only do the spraying outside the patient's house. We do not go inside their houses. So we do around 200-meter radius outside the outside the houses, and the larviciding we still continue to do. And of course, for the dengue mortality, next slide, sorry, next slide. For the dengue mortality meeting, we still carry out all the meetings with the minimum, either to teleconference or with the minimal attendance of the committee. Next slide. So these are the precaution measures that need to be carried out by our health staff when they are doing the dengue prevention control. Next slide. So for the surveillance, we have our National Public Health Laboratory, which are doing the dengue virus serotype surveillance. So this surveillance was carried out as usual during the pandemic situation. However, the number of blood or sample tested slightly reduced compared to the normal situations. Next slide. And this National Public Health Lab is actually the national reference lab for our country, and they're also doing genetic they do a PCR, they do a genotyping, and they also do like serology test, and they also conduct the they also collaborate a network with Singapore, NEA Singapore, and we develop a United Dengue website where we enter our data and we share our data with the ASEAN member states. So there are, I think, about 4 or 5 countries are now giving input into the United Dengue, so we can share our data with the other country. Next slide, please. So these are the analysis of the dengue virus serotype surveillance that done by the National Public Health Lab. So we go to the states, also states with serotype analysis, and also we do it every month and every week. Next slide. So the National Public Health Lab is also helping the program manager in identifying what are the serotypes of virus strains that can cause severe dengue in our patients. So this is one of the example of the results that they gather from the study conducted by National Public Health Lab. Next slide, please. During the COVID pandemic, modified the way we celebrate our Asean Dengue Day. Usually, we celebrate the Asean Dengue Day on the 15th every year of 15 June, and usually we have a convention with the volunteers. We have exhibition. We have a lunch. But this year, we have to modify the celebration by using our social media. So we have intensify social media campaigns. This was led by our ministers, honorable ministers, Dr. Izham Baba. And next slide, please. And all this campaign were carried out at the national level, and also next slide, at the state level. Next slide, please. And this is at the state level. So we have 15 states, and all the 15 states are doing their own activity. Either they are doing teleconference, or they are giving talk in the social media, or in the televisions, or in the radio. Next slide, please. Yeah, also this is at the state level. So you can see a lot of advertisement. Next slide. Next slide. And we also have at the community level. So the ASEAN Dengue Day campaign also carried out at the community level. Next slide. Malaysia started the Wolbachia Mosquito Operation Project in July 2019. Initially, Institute of Medical Research has conducted a study in 8 areas on the Wolbachia mosquito, and this project actually showed good results, where we managed to reduce the dengue cases in 50 to 80% of this area. So starting July 2019, next slide please. Our ministers launched the Wolbachia project in the federal territory states, and starting from July 2019, we already expand this Wolbachia project to about 17 areas. So now we are implementing this operational Wolbachia operational project in our program, in our dengue and prevention control program. So we put this one as one of our methods in our program control measure. So so far all of these 17 areas shows a reduction of number of cases until today, and we hope that we can expand this area, this project to another area, and hopefully way forward nationwide. And we also managed to populate the area with Wolbachia mosquito. All of these 17 area are now being populated with Wolbachia mosquito. Next slide, please. So the challenges that we face during the COVID pandemic situation, we have to withhold our activity with the community because in the Wolbachia mosquito operations, we need to engage the community so that they will accept this project, and they will also help us to ensure that the area are clean, so that there will be no wild mosquito competing with the Wolbachia mosquito. So starting March, we have to reduce our activity in the community, and we only carry out the activity that is done by our health staff. Next slide, please. These are some of the activity before the MCO, where we engage other, not only the community, but other teams, others from Ministry of Health. These are our armed force team that actually also helping us in putting the ovid trap in the area. Next slide, please. So we have also to come out with the in administrative order for this project, because we have to modify the way we carry out the project. Previously, we released the eggs of Wolbachia mosquito, but during the MCO, we released adult mosquito, because the procedure is much simpler compare releasing Wolbachia eggs. Next slide. So starting June, we already in the recovery MCO. So we have to modify our control measure also according to the instruction given by the National Security Council. So next slide. So there are starting May, a lot of the activities that end of May, a lot of the activities were carried out, but taking precautions of prevention of COVID-19, where we have to have a physical distance, 1 meter physical distance during our activity. We have to wear a face mask, we have to use hand sanitizer, and also frequently wash our hand during any event that we are doing. So these are the schedule that you can see in the screen, that where the black one is previously we withhold the activity because of the pandemic, but starting end of May and June, we already start the activity nearly as usual. Next slide. So these are also the activity has been carried out, including training, monitoring visit to the field, to the ground, because for example in the vector-borne disease sector, staff, they have to go to the field at least once a month to look at the condition at the state or at the district level. Next slide. So the surveillance activity continue during the MCO. And the ASEAN Dengue Day, we have to modify it using social media. Next slide. And in the dengue prevention and control measure, case and management, for example, case detection and case investigation, we carried out our activity as usual by taking a preventive measure for COVID-19. Next slide. So these are actually the summaries of what I have informed you before. Next slide. Yeah. So this includes the case management. Okay. Next slide. Okay. Next slide. Sorry. So the challenges of vector-borne disease service delivery during COVID-19 was movement. During the movement control order, there's a limitations of movement for our health staff while they are doing their prevention and control activities. So this also limits the movement of the individual or the community to go to the to go to the health facilities, for example, to do clinic or to the hospitals. And at the same time, there's an interruption of service delivery in the community. So we were unable to enter the houses during the control measures activity, and we were unable to do, for example, massive cleanliness activity in the community. And during the for the mitigation risk of COVID-19 infection, we have to also to do this mitigation risk of COVID among our vector staffs. And during the pandemic situations, we also need to convince our health staff because they will have a fear for these COVID infections for themselves. So we have to convince them that we give them a adequate PPE for them to protect themselves when they are doing the activity at the ground. And during this pandemic also, we have to compete with especially with the COVID-19 management team to get budget or to get allocation for resources. And at that time also, we have a shortage of PPE supply, especially during the early phase of the pandemic. And we found out that the COVID-19 pandemic was very dynamic. It changes from time to time, and you don't know when they are going to change based on the National Security Council order, because we have to also to engage with the National Security Council order and activity. Next slide, please. So way forward, strong program leaderships at the national level is very important, and critical interventions for malaria or dengue control must continue during the MCO. So for us, we come out with the instructions of control measure for vector-borne diseases. So not only for dengue, but malaria, filariasis, and Japanese encephalitis measures during for pandemic situations. So the disease burden stratification for malaria, and also identifying outbreak for dengue and hotspot for dengue are important, so that you can harmonize the critical intervention for both diseases, for COVID and also for vector-borne diseases. For effective planning, the program requires continuous updates of COVID-19 situation, so that we can coordinate our activity with the team, and also apply the preventive and control measure for the dengue disease at the same time. For effective implementation also, the ground people, the health staff, must be updated on what are the changes in your policy and also in your control activity. So electronic and social media are the best platform for communications in during the pandemic situation, either for your health staff and also for the community. So dengue prevention and control program must adapt the new normal approach during these pandemic situations. and the program manager also must be innovative to find ways on how they can carry out their activity during the difficult situation. Next slide. So these are the photos taken during the pandemic. So our prime ministers, our director general, and also the other ministers have to give a daily press statement on the COVID situation, so that the people will be in the know of the situations. And this we have to follow up all the conditions in the country, so that we can arrange for and plan for for dengue prevention. Next slide. So the rest of the slide, I think, is only a pic photos from our activity. This is the Wolbachia mosquito operation activity. Next slide. This is the COMBI, Communication for Behavioral Impact Volunteers. They are also doing the activity now, because we are in the recovery MCO phase. So they are allowed to do inspection, EDIS inspections, EDIS surveys in their area. Next slide. And all our volunteers also need to adopt the new normal. So they have to practice the physical distancing, wearing face masks, and also wearing hand sanitizer. Next slide. So this is the new norm of mass cleaning. So there will be no big gathering. However, they will gather the local people to clean their area. Next slide. So in Ministry of Health, we also have the insecticide resistant monitoring system or program. These are the objective of the insecticide resistant monitoring. Basically is to determine the insecticide resistance status, and also to evaluate the effectiveness of our control measures nationwide. Next slide. So in Malaysia, we are using the WHO standard WHO bioassay, CDC bioassay, and this insecticide resistance status monitoring usually we carry out in the dengue persistent outbreak area, where they use a lot of insecticides, and this result we also share with the states and also with the respective agency. Next slide. So these are the insecticide board. We have an insecticide board to make decisions for the country. We have an insecticide resistant technical working group who will analyze all the data and the analysis for the country. And we have about 142 entomologists who carrying out all these insecticide resistant activities. Next slide. So these are one of the activities that they're doing for the insecticide resistant laboratory activities. So I think my last slide is, if you don't mind, you can play the video. This is a dengue media campaign by our honorable ministers, health ministers of Malaysia. Kindly play the video. Thank you.
Thank you, thank you very much. Terima kasih, Rose. I was going to ask a series of questions about COVID and the response, but you seem to have answered those perfectly in that amazing presentation. What a response in terms of Malaysia, the robustness in terms of the vector control activities. A round of applause, I think. The feedback we're getting is similar to that from the attendees as well. You mentioned Wolbachia. I just wanted to say that Professor Scott O'Neill, the founder of the World Mosquito Program, I'm sure you know, he's on our dengue advisory group as part of our World Dengue Day advocacy. And we have a lot of content built up from the ISNTD Connect series that we put together during the lockdown, so 2 times a week. My colleague Marianne, who I've said before is much more photogenic than myself, she does the ISNTD Connect series. We've had Gabriel Yan from Singapore, speaker at the National Hospital there, speak about, he wrote a small letter in the Lancet journal, and we picked up that, contacted him from here in London, and that was the first ISNTD Connect that we did in terms of patients presenting who've both got dengue and COVID. How do you differentiate that from a clinical management perspective? Scott O'Neill has done, he did a brilliant session on Wolbachia and dengue. We've also got climate change as an issue that we've covered. And I'll send you the links in the chats to everybody there. We've got 10 minutes left before the session auto cuts. The way the system is configured, we've got a lot of questions from the people coming through. And so I'm just wondering, do you think we should, could we assemble the panelists back together? And just a few questions to you. We'll have to end in 10 minutes, but we can then place all the rest of the questions onto the lobby area of the virtual room. And this will be on replay for straight away. And then this is a system that's live and it will remain live. So it will be like a hub. We're keeping it open for everybody, all the researchers, everybody. It's not just a one-off. Everybody can come and interact on this hub moving forward. So is that okay to get everybody back on? Can we get everybody back on? Is that okay? Assalamu alaikum. Nadia, Norelin, hi there. Yeah, brilliant. So firstly, thank you very, very much for a wonderful series of presentations. This is exactly why we want to give the ASEAN effort, the ASEAN Dengue Day, 15th of June, prominence in terms of any global movement. World Dengue Day, you have a natural leadership position clearly demonstrated by the work that you've just highlighted, all 3 of you. So that's really underlined that. My kind of questions that I was going to ask you really were going to be about the COVID-19 situation, but I think they've actually been answered. And what I wanted to do really was kind of open that up to the floor, to the assembled respected audience. And I'm just trying to get that, the question. So here's a question from Helena Uliartha from Indonesia. It's for Dr. Rose. Dr. Rose, based on your experience of more than 10 years in vector control, what is the most effective control program strategy as we are now about 70% of the dengue burden in Asia? And congratulations for the Wolbachia mosquito and dengue control program. That's to Dr. Rose. What is the most effective control program strategy, vector control program strategy? Dr. Rose, that was a question from Helena Uliartha. from Indonesia, I believe, asking, in your opinion, oh, I think we've just lost Rose there. So I'll ask that question to both of you. You're here. So starting with Norelin in the Philippines, Ministry of Health there, what's the most effective vector control, in your opinion, as we stand today?
In my opinion, it's not the specific or particular vector control per se, but the community integration, the people, because all the programs, it will be led by the national government, but every individual, every Filipino, every individual has the responsibility to act on, and they have the responsibility to prevent certain diseases, not just dengue, but also other infectious diseases as well. And integrated vector management, I think, is important. You have to explore. That's what we're doing right now in the Philippines, as I've mentioned a while ago. We are having a two-way approach, not just on the preventive aspect, including the integrated vector management, but we're also looking into the curative aspect of public health. Like, we're trying to review updates in clinical management, establishment of dengue center of excellence. Since dengue, with the rapid increase in urbanization, it's becoming multifactorial in nature, and we need a whole of the nation action, collaboration, and also our approach should not focus on one component,
Yeah.
but
A
holistic
more
approach.
integrated,
Yes.
the WHO position, I guess, is the fully integrated, and absolutely, we absolutely support that as well. Here's a question for Nadia, actually. Thank you for that, Norelin. Here's a question for Nadia. I know that Jakarta will be moving the capital. There are plans to build a new capital. I can't remember which island, but it's going to be moving to another island. How much input has the vector control department got in terms of built environment, mosquito proofing the new development? I was saying that because Norelin, you mentioned rapid urbanization. This is not rapid urbanization, but it's certainly a chance to showcase a new kind of environment, new buildings. Are there any plans for involvement of the Indonesian vector control program? Your input into that planning?
Yeah, okay. Kamran, of course, our president plan to move our capital into Kalimantan Island. Yeah, I just remember that. Of course, this new capital will be established with consideration from many aspects. So this is like a modern capital. And of course, if we build the modern capital, it will be integrate all the aspects, including first they have to free from the disease, and which means that the disease is including the disease that transmit through a vector or from zoonotic. So there will be a management of vector control, but it's mostly based on the physical change. So it's mean how to build a good waste management and a good road and etc. So it's integrated plan. And the first thing is it should be free from the disease. So all the architect and everything is what we call it is based on the health issue to establish new capital.
That's very interesting, because we have the next session will be about later on built environment, and we have a solution provider in terms of a sustainable solution as well. And also we've got people like UN Habitat who are in attendance this conference as well. So very interesting to see how those kind of worlds converge. Again, it underlines the role of vector control. We said this right at the beginning of the day. The vector control element is actually the driving force when it comes to getting to these WHO NTD targets, we feel, and it's really something that needs to be given a proper platform. So we're very interested in that. I've been given the sign that I've got 3 minutes before it cuts off. 2 minutes now, so it's going very quickly. I'm just going to try and pull up some more questions. So I'm just going to try and pull up some questions here. Okay, I'll actually, no, I know what I'll do. I'll ask you this very quickly. I'm going to have to ask you this, and then. As you know, we're campaigning for the World Dengue Day, and as we are absolutely delighted that you in your presentations have said that the Ministries of Health are standing with us. I know from our talks to the ASEAN Secretariat, they're standing with us to back the World Dengue Day, calling on the WHO to back that. We've got 25,000 plus signatures on a live petition on change.org. I've shared the details. Please help spread and share that. As a leader or as individual leaders in regional advocacy and actual vector control, as you've shown in your presentations, especially within dengue, from that leadership position, what if you could give a message? We've got about a couple of minutes. What message would you give to the global community? We've got people from Brazil, Chile, Latin America, Africa, Ghana, Mozambique, Asia, India, Pakistan, they're all on this in attendance. What's your message to them as a leader in vector control activity in dengue? What's your message to the community? I'm going to ask you, starting with Rose. Rose, I don't know if you can hear. Okay, we'll ask that to Nadia. Then, what would be your one message? If suddenly there was a World Dengue Day and people will naturally look at the ASEAN member states for leadership, what would be the message you'd give them?
Yeah. Okay. So in the simple way, I could saying that let's make dengue like HTB malaria disease. So how the globally, regionally, even nationally looks this dengue as a priority and at each level.
Okay.
And of course, during COVID-19, involvement of the community will play a big role in terms of controlling dengue.
Fantastic. So, fantastic. Look at the success story of HCV programs inside and in the region, and look at the and this COVID issue. Fantastic. And the community, the asset that's the community. Norelin, could I thank you for that? Dear Makasi, could I ask Norelin for that, for your opinion? What message would you give?
Okay, so thank you, sir. This COVID-19 pandemic has an extensive global effect in all of us. I think community empowerment is very important, plus integrated vector management and health awareness. So this is a good formula for helping us in our battle, not just against dengue, but also other infectious diseases.
Fantastic. I like the kind of health awareness, because that's the role for HCPs, it's the role for private sector, the role of the citizen. There's a vacuum when it comes to this. Everything's on social media these days, and if we don't talk, then we are then defined by other. Yeah, it's happened in the anti-vax movement. We can see it is. So that's a very interesting point you've made there. Norelin, I thank you for that, this educational awareness raising. And given in COVID, everybody is now into public health. That's one of the silver linings of COVID. Everybody's interested in public health. So, Rose, I don't know if we can get a message from you, but I know we're having connection issues. I'm very sorry. I don't know if it's on our side or your side, but would you have a take-home message if you were going to about? I think it's going to be difficult to get I think we're going to lose you there, Rose. So I wanted to say thank you very, very, very much. Terima kasih for all of this. We could spend all day speaking about this. There's so much to unpack. You mentioned Wolbachia, you mentioned also insecticide resistance. That's coming up later. But as a starting point, absolutely fantastic panel. Delighted to have an all-woman panel. I think that's very important. We are 100% with you on that. Excellent. Alhamdulillah, it went very, very well. And the questions that the people have asked, the attendees have asked, they will not go to waste. We're going to put those onto the lobby section. And then later on, we are going to collate some recommendations from your, we're going to produce a small white paper document, which we're going to send to you as the write-up and the output, leadership output from this panel. So these are what the ministries are saying. And we're going to, with your permission, we're going to put that out globally to we've got about 25,000 subscribers to our kind of, it's a growing community. We're going to put that out as well. I've mentioned everything else in terms of the petition and all of that. So it's all there. I think we're going to have to kind of call that up now, simply because I'm going to get in a lot of trouble if I go over the time. The next panel is due. We've got a 15-minute break, 10-minute break, and we're resuming at 1:30. I would just like to end by kind of saying thank you very, very, very much. Please, all the attendees, give a round of applause, a digital round of applause, right? We cannot thank you enough. Rose, thank you. You're back again. Thank you very much. Yeah. And amazing efforts in all these countries is exactly why we wanted you at the helm of the World Dengue Day. We are delighted that you're backing this. We need country requests to go to the WHO, the World Health Assembly. Will be in communication through Ferdinand, Fernando, Michael, Glenn, and Randy, Adrian at the ASEAN Secretariat. And please join the DAG, join the Dengue Advisory Group. We can liaise after this, but we'll be honored to have you guys. We have Dr. Hasitha Teresa from the Sri Lankan Ministry of Health, Dr. Somya Iqtidar from the Government of Punjab. They're on the Dengue Advisory Group. It would be great to have you guys on there, flying the flag for your sovereign efforts. And I'd like to applaud that. And I think we're going to take a break now and come back in 10 minutes. All of this is now being replayed on that channel, on the talk channel. So thank you very much. And Eid Mubarak to anybody who's in advance for tomorrow. It's the big Eid, so thank you to everybody. All right? Jazakallah khair. Assalamu alaikum wa rahmatullah. Goodbye, Norielyn, as well. Take care. All right?